that many in the media have been speculating about bruising on the president's hand and also swelling in the president's legs. So in the effort of transparency, the president wanted me to share a note from his physician with all of you today. In recent weeks, President Trump noted mild swelling in his lower legs. In keeping with routine medical care and out of an abundance of caution, this concern was thoroughly evaluated by the White House Medical Unit. The president underwent a comprehensive examination, including diagnostic vascular studies. Bilateral lower extremity venous Doppler ultrasounds were performed and revealed chronic venous insufficiency, a benign and common condition, particularly in individuals over the age of 70. Importantly, there was no evidence of deep vein thrombosis or arterial disease. Laboratory testing included a complete blood count, comprehensive metabolic panel, coagulation profile, D-dimer, B-type natriuretic peptide, and cardiac biomarkers. All results were within normal limits. An echocardiogram was also performed and confirmed normal cardiac structure and function. No signs of heart failure, renal impairment, or systemic illness were identified. Additionally, recent photos of the president have shown minor bruising on the back of his hand. This is consistent with minor soft tissue irritation from frequent handshaking and the use of aspirin, which is taken as part of a standard cardiovascular prevention regimen. This is a well-known and benign side effect of aspirin therapy.
Hi, my name is Dr. Rubin. I'm not here to speculate about the president's health, but to help educate you about chronic venous insufficiency, which is not generally considered a benign disease. It does increase the risk of developing various complications because over time, the veins in your leg, which are responsible for bringing blood back to your heart, can become leaky as the valves have degenerative changes. So blood ends up pooling in the legs, which can cause edema or swelling and discoloration, as well as potentially ulcers if left untreated. And in some cases could increase the risk of developing blood clots, often in the form of deep vein thromboses. And sometimes these blood clots can travel to the lungs and lead to a life-threatening condition known as pulmonary embolism. So usually conservative management is employed in these cases, such as compression stockings, various exercises, elevating your legs, trying to make sure that mobility is present, weight management, sometimes medications are used, as well as surgical interventions. So this is something that people are going to obviously be asking a lot of questions about. I'm on social media. I try to educate people about what's going on in the world around us to try to give you a little bit more clinical context. So if you find this helpful, please share this widely.